My name's Louise Bradshaw and I'm the Nurse Manager at Midland Health. It's important to look after your sexual health. It should be treated as any other part of your health, your mental health, your general health. It's important to make sure that you're healthy, but also so that you don't pass on any sexually transmitted infections. So there is a lot of stigma surrounding sexual health, and there shouldn't be. At Midland Health, we ensure we are very approachable. We have a lovely relaxed environment and setting for patients to come into. And of course, we are non-judgmental in the way we approach patients during consultations. As with a lot of places, we always offer a chaperone and just treat patients with the most care and compassion and empathy as possible. There are a lot of contraceptive options available, both hormonal and non-hormonal. You are more limited with non-hormonal methods. Non-hormonal, mainly you have your barrier methods such as condoms, female condoms, a copper coil. Hormonal methods of contraception involve coils again, pills, patches, implants. There's also vaginal rings. So there's a lot of different contraception around. If one doesn't suit you, we can always try and navigate to find something that does suit you and your lifestyle and your sexual life. Hormonal side effects can be things from, just skin changes, bleeding pattern changes, mood swings, but we're here to help. We're here to try and just navigate patients through any side effects that you may be having. It may be that we need to try a different method of contraception, but it does also come into play how much patients can tolerate. Everyone's tolerance levels are different. So if a bit of minor spotting a patient can tolerate, then that's great. We can continue with that method. But again, we're here to talk to help patients work through any side effects that they may be having. STIs are very common. It's very easy to find out if you've got a sexually transmitted infection by testing, by a simple swab that can be taken, a blood test or a urine test. A lot of infections do have symptoms, be a discharge, an itch, a burning when you pass urine. However, a lot of infections can be dormant as well, and they may have no symptoms at all, or they can be asymptomatic. If any patient presents with any sort of abnormal discharge or anything that's unusual for them, we'll always recommend testing for STIs and also non-STIs for things like thrush, bacterial vaginosis. So it's really important to just come in, explain fully whatever information you have, whatever symptoms you may be experiencing, so that we can get to the bottom of it and just help you live a healthier life. I'm very passionate about safe sex and promoting safe sex amongst all ages. We are finding that there is an increase of STIs in the over 40s. There is also an increase in termination of pregnancies or abortions in the over 40s now. The key things are to be safe, as in with regards to testing. Always get tested, both of you. It's really important that you go into that relationship knowing that you don't have anything that you may pass on. If testing at that moment in time isn't possible, then always use a barrier method. Always use a barrier method if you are unsure of that person's status with regards to HIV, chlamydia, any sort of sexually transmitted infection. Just be aware and talk about these things. I think by reducing the stigma that's attached to sexually transmitted infections and sexual health will really encourage people to come forward and discuss these things and ultimately to get tested and be healthy. If you are interested in booking a sexual health screen or just discussing your contraception or sexual health concerns, you can always get in touch with us via the Midland Health website or giving a call to our friendly customer service team.